Okay, so welcome everybody. Welcome to our bit of a conversation here, a little more of an informal setting than the typical webinar. But here, my name is Tom Pachal. I'm the manager of clinical services at the Wellness Institute Clinic, and I'm here with Dr. Kevin Saunders. How are you doing today, Kevin?
Very good.
Good, right on. So we're here to talk about our newly launched weight loss and risk reduction clinic. Kevin's going to dive a little bit into kind of some of the things that helped us come to and create this clinic, and a little bit more information on that, and just share some insight there. And there'll be some option to ask some questions and pick Kevin's brain on his expertise. So as they come up, feel free to drop any questions into the chat function below. We'll also be putting in a link to our program website in the link below, so feel free to check it out, and there's a lot more information on there as well. But yeah, we can just get to it. So let's just start out with a couple questions for you, Kevin. So lifestyle and health behavior modification, they've always been big pillars to sustainable weight loss. Can you give us a bit of a background on lifestyle interventions and if they'll still be important with this new wave of medications that are hitting the market?
Yeah, lifestyle is still the cornerstone in weight loss management. And it's important not only for weight loss, but it's also important for overall health status of the general population. And the lifestyle is something that most of us realize we need to do, but unfortunately in our busy world today, many are finding it increasingly difficult to maintain a healthy lifestyle. As a baseline in Canada, recommendation is that you get at least 30 minutes of physical activity most days of the week. And by physical activity, and you noticed I used the word physical activity and not necessarily exercise. Yeah. Physical activity can include anything from going for a walk by yourself or with a loved one, to shoveling snow, to gardening, anything where you're actually picking up your pulse rate and burning calories. If you exercise, you get a correspondingly increased benefit. And so for those that are interested in coming to places like the Wellness Institute or going to Killonan Park or playing old-timer hockey, there is an enhanced benefit. Healthier diets are critical for all of us. In North America, we consume far too many carbohydrates and we consume too much fat in our diet. And so focusing on a diet that reduces those, I call it the soft vegetarian type diet. And what I mean by that is lots of fruits and vegetables, smaller quantities of healthy protein are very beneficial for overall health. If you combine the physical activity and healthier diet, most people can achieve weight loss in a slow and progressive manner.
Yeah. No, yeah, those are all really good points. So then, obviously, yeah, lifestyle intervention is still kind of the main crux here and what we want to focus on. But obviously, the new big talk has been about these weight loss drugs and these new medications. Can you give us a little bit of insight into kind of what those are, what we can expect, and are they going to be the new solution to weight management, or how are they going to fit in?
So what we've found over time is that lifestyle for the majority of the population hasn't been enough. And we've had a variety of different fad diets over the years trying to top up or accelerate weight loss. And unfortunately, in the long run, the long-term data shows that none of these diets really work in the long term. So we've had Atkins, we've had South Beach, we've had keto. When people are on these diets for short periods of time, they actually do achieve a fairly good amount of weight loss. But the diets themselves, based on their restrictions, don't allow people to achieve long-term weight loss, because eventually people get tired of the diet and they eventually fall back on old poor eating habits. So Obesity Canada published guidelines in 2020, and they basically have looked at all of the data over many years. And their recommendations have come out as, number one, lifestyle is a cornerstone. So diet and exercise, working hard, trying to drop the weight in a healthy manner is absolutely cornerstone number one. For those that can't achieve the necessary weight loss on diet and exercise alone, pillar number two is now medication intervention. So it is in our medical guidelines that we should be treating people with medication to help them achieve weight loss if they're not getting it on lifestyle alone. And the reason for that is both the world, actually all of the World Health Organization, Canadian Medical Association, and American Medical Association all recognize obesity as a chronic disease. And what I mean by that is being overweight with a body mass index of over 30 certainly does result in chronic medical problems. And the higher your body mass index, the higher the risk is to your long-term health. The obvious issues include arthritis from too much weight on our body, diabetes, vascular disease, but also cancers are increased in people who are too heavy. And it's not a shame game where people are having difficulty struggling with their weight nowadays. We live in a society where cheap calories are readily available, and we're far too busy to spend enough time actually looking after ourselves properly. So medication for those that are struggling with their weight is now recommended as something that should be offered to individuals who are struggling with their weight. We're advised as doctors to treat weight as we would any other chronic medical problem. So we should be treating it like we would a diabetic, like we would a hypertensive, like we would a patient with arthritis. We should be treating patients aggressively and medically to help them get their body weights down. We've known that for a long time. The problem being is we've never had any good medications in the past that actually really worked well for people. There was a medication that came out about 20 years ago called Xenical, and it was all of the rage for a year or two, but the amount of weight loss that was achieved with it wasn't great, and the side effect profile was terrible. In the last few years, there's been an explosion of medical research around this area called GLP agents. And the GLP agents actually were designed and targeted for diabetes. They are very effective in lowering the blood sugar of our diabetic patients. But what was actually detected in the studies was these patients, not only did their diabetes get significantly better, but the patients were losing significant amounts of weight in the neighborhood of 5 to 10 to 15% of their body weight when they were starting on the medication. So a person that came in at 200 pounds was dropping down to the 200, 210 range, which was really quite a striking finding because it was the first time that we actually found agents that worked. So the company subsequently went on and did studies going, okay, so what if a patient doesn't have diabetes, but just wants to lose weight? Will these medications negatively affect their blood sugar and drive it down too low? And will the medications actually still result in weight loss for the patient? And there's been lots of research done, and the research clearly shows us that if you have a normal blood sugar, the agents do not affect your blood sugar. It stays the same, but you still get the weight loss benefit from the medication. So the big two that have been launched lately, semaglutide, is out on the market, widely available as a diabetes medication. At a slightly higher dose is going to be launched as a weight loss medication shortly. And most recently, a newer version called tirzepatide has been launched, and again, released right now in the diabetes version, with the weight loss version at a slightly higher dose to come shortly. These medications substantially lower body weight, and they allow a much higher percentage of people to get the weight loss that they need in order to protect their health. So from a medical point of view as a doctor, for the first time in my 38-and-a-half-year career, I actually now have medications that I can offer patients that I know will help them. Again, please remember, lifestyle is the cornerstone. We want you walking, we want you physically active, we want you eating healthier. But for those individuals for whom that is not enough, who are really struggling with their weight, these medications can offer a significant assistance in dropping the weight. One of the issues with them is that most patients who go on them will need them long term. But when I talk to my patients, it's basically, if you go on a cholesterol or a blood pressure medication, you're usually on them long term.
Yeah.
And they basically control your cholesterol and your blood pressure. Diabetes medications, pretty much the same. Once you start on them, you're on them long term. I don't have any problem with prescribing these new weight loss medications, even if my patients need them in the long term. My rationale is pretty simple. If I can get 20 or 30 or 40 pounds off of you, then you're probably not going to need the blood pressure, cholesterol, or diabetes medications down the road.
Yeah.
And so again, and also going back to the Canadian Medical Association, it's a chronic disease. Mm-hmm. And there's been tons of evidence about the yo-yo dieting of the past, where people right now, this time of year, New Year's resolution, and I've got one, I need to take off 10 pounds in a hurry personally. People go on the diet strict for 2-3 months, they drop a bunch of weight, they eventually fall off their diet, they gain all of the weight back, mm-hmm. plus an extra 5 pounds with the yo-yo dieting. So what we're looking for is a longer term mm-hmm. solution. Longer term solution, healthier lifestyle critical, medication if you need it to help get the weight off, to help prevent all of the negative things that having excess weight does. Okay. I mean, there's data out there that shows that people with a body mass index of over 40, and I have many patients in that ballpark, lose about 6 to 10 years of life.
Oh, wow.
That's a big number. Yeah. And so for those patients especially, dropping a significant amount of weight will help prevent a lot of the negative mm-hmm. consequences of the excess weight, and can and most likely will extend their lives by years. Mm-hmm. So it is truly it's a worldwide problem mm-hmm. right now that we're facing with our weight as a whole. It's not an individual shame, blame in any way, shape, or form. What it is it's a health problem that we're developing, mostly because of the complicated societies that we're living in today.
Definitely. Yeah. So essentially how you're saying is that we want to focus on getting in that adequate activity, making sure that our nutrition and diet is in check and our health behaviors are there. And then if needed, we can consult for some, medication to supplement that. But that main crux is we want to, what are we doing in our day-to-day lives to manage this first?
Yeah. I mean, we, as collectively as a society, we have a big problem because our prevalence of obesity is growing dramatically. Yeah. Right now in Canada, in the adult population 18 and over, I believe the latest data is we're hovering around 35 to 40% of our population. Mm-hmm. We know that population is at significant risk for the development of medical problems. Yeah. Prevalence of diabetes is growing astronomically. Mm-hmm. In the early 1990s, prevalence means what percentage of the population has a medical problem at any given point in time. In the early 1990s, the prevalence of diabetes in Canada was 3%. So 3% of the adult population in the early 90s was diabetic. Right now, today, it's in and around 12 or 14%. Wow. And within the next 5 to 10 years, it's going to grow to 20%. 1 in 5 Canadian adults will have diabetes within 5 to 10 years. And that's largely driven by physical inactivity, poor diet, and increasing waste, mm-hmm. basically. So we really, our healthcare system will utterly not survive those numbers of people unless we make a change collectively. Yeah. And then individually, we have a responsibility to ourselves and to our families and loved ones that we all want to live healthier and we want to live longer, and we don't want all these medical problems that are going to follow. And so weight is the biggest issue that we're facing right now from a public health point of view as the pandemic is calming down.
So yeah, you talked about a bit, societal concerns and the public health. So, from your perspective, as a physician, why would you think that a program like the one that the Wellness Institute is launching here, why do you think it's so important at this time?
Yeah, so I mean, we're actually relaunching because we had our program that
Yeah.
was strongly based on lifestyle
Yeah.
only, and we did achieve significant results in the initial first couple of waves of the program. And so we know lifestyle works, but it doesn't work for everybody.
Yeah.
And so our numbers in the initial waves were probably 35, 40%, achieved a very significant weight loss, but we had half or slightly more than half who simply didn't get the weight loss that they were hoping for. And so the relaunch of our program now, and now that we have access to these new medications, the relaunch is going to follow best practice medical advice. And best practice medical advice is start with your diet and exercise program, see what you can do naturally on your own without medication. That's always preferred. If you can, I'm not a drug pusher. If you can do it on your own without meds, very happy to see that. But we know historically it's not enough for a lot of people. And now with the addition of these medications being available, our program will include actual being able to see myself and being able to get prescribed medication and being followed by myself medically to enhance the effects of your diet and exercise program.
Just a quick question
So,
here. Just a quick question here. What can people expect from the program in terms of the exercise component of that? What does wellness offer in terms of the exercise support in terms of the weight loss clinic?
So just, I'll kind of take that as a full chance to dive right into the program as a whole. So what it is and what does it offer? So it's a 6-month robust program. So anybody that comes towards our program will go through a bit of a screening process to ensure that they're eligible to enter the program. From there, they'll get set up with a exercise physiologist as their health coach, where they'll go through initial screening, they'll do some blood work, and just everything to kind of get to the biggest picture about, okay, who is this individual in front of me and how can we best cater this program to them? It's a very individualized program. It's not a cookie cutter. Everyone gets the same piece. We want to make sure that we're fitting your lifestyle. How can we target it? How can we make those improvements? And where are we going to work from there? So we start with the exercise physiologist and health coach. You get the opportunity to work with a registered dietitian and a cognitive behavioral therapist to work on the nutrition, the eating portions, relationships with food, health habits, etc., and building on that, as well as a cognitive behavioral therapist to work on any kind of psychological barriers, mental health challenges, setting goals, stressors, and etc. And then based on that, if we still persist with those struggles, there's the opportunity, as Dr. Saunders mentioned, to consult with him for a medical review and explore those options. As for the actual exercise component, as the question was asking, so anybody involved in our program has complimentary access to our state-of-the-art Wellness Institute facility, the full gym for that 6 months of the program, and they're also working with their health coach, who is a certified exercise physiologist, for some exercise prescription, guiding them along the way. They have bi-weekly check-ins where you can either come on site or meet with them virtually, whatever works more convenient for you. You can do a workout with them, or they'll prescribe you home exercises and guide you all along the way. We also have a digital platform you're working with through the program that's going to have the opportunity to sync if you have a smartwatch, or you can input manually to track your steps, your blood pressure, your weight, your daily exercise levels. So to keep you logged in along the way, and then your health coach can monitor that as they check in with you and offer those changes, solutions, whether we're going to move forward with something, alter something, regress here or there, just to make sure those ebbs and flows are covered and guide you all along the way. So that's kind of the exercise piece there. And then a bit of a soap notes of the program. So as I said, it's 6 months. It's just quite the robust. And as we spoke about, the target is that lifestyle intervention. And then if needed, we can consult for those medications on review. But the big thing is about driving long-term health behavior change habits, making sure it's sustainable and it makes sense to you and suits with your life, because everyone has different barriers, and how we're going to address that is going to be different. I don't know if Dr. Saunders, you have any kind of insight onto that, just some barriers you've helped some clients work around and work with?
There's lots of barriers. We are, unfortunately, we are pre-programmed. The foods that give us the biggest pleasure in life are the foods that are worst for us. And if you drive down McPhillips from the wellness here heading south, You're going to see no end of Burger King, A&W, McDonald's, Popeye's Fried Chicken, Kentucky Fried Chicken. You don't see a lot of salad bar restaurants. And the reason is quite simply, when we're really hungry and when we're stressed out, our brain actually craves foods that aren't really good for us. And those foods are basically, especially post-pandemic, cheaper than fresh fruit and vegetables. And we're programmed to like them. And our lives are programmed right now to do less and less. And what I mean by that is, we have remote controls for our TV, we have remote controls for our garage, we have snow blowers, we have self-propelled lawn mowers, and then we hire a lawn service to use our self-propelled lawnmower to do things for us because we're really busy at work, we're running around with kids, we're really stressed out. And so, I mean, we're in it collectively. This is the world that has developed around us, and we actually need to physically search for ways to get ourselves more physically active, and we need to develop a more reasonable diet lifestyle. And you know, I crave pizza, I crave hamburgers like everybody, but I can't be eating them every day.
Yeah.
And so on a Friday night, pizza night as a treat, dynamite. Moderating those types of foods on an ongoing basis. So where I'm going in a long-winded fashion, we all need to develop chronic changes. Okay, we need to develop lifestyle changes that are sustainable for us, basically for the rest of our lives. Because if you look at weight loss as simply I'm going to go on a severe diet for 2 months and then I can go back to my old lifestyle, we all know that doesn't work. And our ability to keep that weight off and our ability to long-term manage it, society shows, our numbers show that that's not effective. So when we look at it, and the program really tries to instill that, that's the beauty of the 6-month program with the professionals that you work with. These are long-term health changes that all of us basically need to achieve. And you don't do that overnight. You don't accomplish it. There's no quick fix. And the medications themselves are not a quick fix. The medications are a quick fix in that they help you take the weight off, but physical activity and diet also play a big role in chronic health problems. And so if you just take the weight off, but you don't incorporate the other, you're not getting the maximum benefit that you could for your long-term health.
And I think the big key is just that guidance that these professionals can help you along, because as you mentioned, the food options, you know, it's common a food desert where the only option is those quick and easy, not good for you foods. And there's, you know, some people, you might not be able to have a backyard at all where you can have a garden or fresh produce, and there's only quick, easy. And there's also, you know, physical activity desert where there's not a local park or you don't have access to a gym, you know. So it's about meeting with these specialists and professionals to help find those ways and guide you along through that.
It needs to be a very individualized approach. All of us are different. All of us have different work schedules. All of us have different financial means. And so it needs to be an individualized approach in order to achieve this over the long term.
Yeah, definitely. And I don't know if you have any other questions in the chat here, but we can open up to the floor to answer any questions that may have come through.
We have a question for current members. Will they be getting a rebate, or how does that work for people that are already here if the facility is included in the price of the program?
Yeah, so for the program, any current Wellness Institute members, their membership would be able to be put on hold at no cost during the program itself. So that's 6 months that they're in the program. They wouldn't be paying their membership dues, just for the program. So there wouldn't be any extra costs incurred on that. And even the program itself, we always recommend to look in if you have private insurance, because working with the registered dietitian and the therapist, that those are typically covered by most private insurance providers. So you can have over half the program covered by private insurance if your program is eligible. So lots of ways to kind of save and make it more financially digestible for you, pun intended. But any other questions?
What about eligibility? Who can be part of this weight loss clinic?
Yeah, so the eligibility is open to it's pretty broad window. So one is just you have to be a resident of Manitoba, and then you have to be over the age of 18, and then you can't have an active eating disorder. So an active eating disorder is something that would be to be managed separately beforehand before we can focus on this stage in your path of change. So as long as you meet those 3 requirements, you're eligible to participate within our program.
Is this program, what if we're doing great on the program, is it end at 6 months, or is there some way to continue on getting the support and the follow-up on the exercise component or the nutrition component?
Yeah, so once the program concludes after 6 months, we do offer a maintenance phase. So just be an extra month by month continuation where you can still meet with your health coach just on a more infrequent basis, just to kind of continue with that guidance and that support more on a longer term. And that can go as long as needed. So we don't just kind of end at the 6 months. There's an opportunity to continue onwards, as well as with the dietitian and the therapist. There's the opportunity to work with them privately afterwards, just within the clinic realms.
And how do we get started if we want to join?
Yeah, so the best way to get started is, as I mentioned before, the link to the website should be dropped in the chat. If not, you can also go on the wellnessinstitute.ca and then search up weight loss clinic. And then there'll just be our landing page there, which will have a lot of information, really detailed. It'll have a little box just saying, are you eligible? You can click that, answer those 3 questions. If you're eligible, then it can move you forth. And then from there, you can go through our online booking site and book in your first appointment.
So that looks like I'll just one last question. Does anybody else have any additional questions? We can throw them in the chat box here for Dr. Saunders and Dr. and Tom Pachal here. Sorry, Tom. No, it looks like that's it. No additional questions here through the chat.
Well, right on. Well, thanks so much for your time, Dr. Saunders.
Yep.
A lot of good information there, and hopefully some good takeaways for everyone at home.
My pleasure. Good luck on the weight loss journey.
Yeah, right on. Well, take care.